Hello, everyone, and welcome to Question Lab. Tonight's a special version of Question Lab because it's our 100th Question Lab, and we're happy that all of you are here tonight as we discuss the topic of pharmacology. Leading our discussion today, once again, is Dr. Paris Vicaria, and he's going to introduce himself to you now. Paris.
Thank you, Sean. Hey guys, my name is Paris. I'm a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went on to do medical school back home in Michigan. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
So with that being said, I know we talked about RX Coach. We'll talk more about it later, but what I want you to know for now is RX Coach is our tutoring and coaching program. We work with students one-on-one. The methodology that we will employ this evening as we dissect 4 questions on the topic of pharmacology is similar to the methodology we use in RX Coach. So without any further ado, let's go ahead and get into our first question of the evening. As you can see, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process, and we don't want you to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer the question on test day. So I've gone ahead and removed those. Once we cover up those answer choices, we'd like to begin with the lead-in. The lead-in is the last sentence or the question itself. And we do that first because we want you to know what the test writer is asking before you read that vignette, so you can pick up on all of those relevant clues and not have to reread that question and waste valuable time on test day. So let's read that lead-in now. Which of the following adverse effects is most likely to be seen as a result of this medication? Which of the following adverse effects is most likely to be seen as a result of this medication? Now, after we read the lead-in, we'd like to ask our students how many steps they believe this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. And an example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require. And then we'll go ahead and move on to that vignette. I'll give all of you a few moments here to respond. If this is your first time joining us in Question Lab, welcome. We do these every Tuesday, and we're happy to have you here. All right, I see some responses coming in. Let's take a look at that vignette. A 50-year-old man in the intensive care unit has been unable to pass urine since undergoing an open colectomy 3 days ago. Bedside ultrasound shows 850 milliliters of fluid in the bladder. The patient is prescribed bethanechol. Which of the following adverse effects is most likely to be seen as a result of this medication? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Boris.
Thank you, Sean. So we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, they generally will give you information about demographics. And in this case, we're told it's a 50-year-old male. Okay, so you want to make note of that because that can automatically start to clue you in on what you should be thinking about in terms of differential diagnoses and things like that. Then they usually tell you, why are they coming into the hospital? Why are they in the ICU? Why are they in the ER? And in this case, it's because of not being able to pass urine. Okay. A lot of times they'll tell you how long it's going on. In this case, we know a little bit. They said since having that surgery 3 days ago. So there's a little bit of chronicity there, and you always want to make note of that as well. Okay. Now you can see there, we know that we are doing a pharmacology topic. So information about the drug in the vignette is going to be very important. And specifically, they're asking about adverse effects that's most likely to be seen with this medication. So I think we've got this could even be just a 1-step question. I think, we already know what the medication is. And I think now we've got to determine what are some potential adverse effects of this medication. They may take it a step further and say, maybe there's a couple of there that are possible adverse effects, and maybe one of them is more likely than less than another one because of this patient. But I think it's at least a 1-step question where we need to know the side effects of this medication. So let's go ahead and let's take a look at those answer choices. And once again, we have 5 answer choices here. And usually when we work with students, we recommend that when you're going through answer choices that you start at the bottom and you work your way up to the top. So start with answer choice E and work your way up to answer choice A. The reason we do this is because, a lot of times we'll see students who start at the top, they'll see something they like, and they'll select it without having gone through all the answer choices. And so sometimes they'll get that question wrong. So we recommend doing it this way to prevent yourself from making that mistake and biasing yourselves. So let's go ahead and let's do that now. E, sensitivity to light. D, involuntary muscle contractions. C, hypertension. B, dyspnea. A, decreased urinary output. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here. We'll talk about it in just a few seconds.
All right, well, I've gone ahead and opened up that poll for you. We'll give all of you a few moments to respond. Keep in mind that there is no penalty for guessing on test day, certainly not tonight. So if you're unsure of what the answer is, don't worry, take your best guess. Then we'll go over and give you an explanation of the correct and incorrect answer choices in a moment. So once again, I'll wait until about 2/3 of you have responded. All right, I see responses coming in. We'll give all of you a few more moments here. All right. All right, let's take a look and see what all of you selected. Well, it was close. 36% of you selected involuntary muscle contractions, and 25% of you selected dyspnea. So let's take a look and see what the correct answer is. And the correct answer is B, dyspnea, and 25% of you got it right. So let me go ahead and hand it off to Boris.
Thank you, Sean. Yes, definitely a tough question here. So let's take a look at what's going on. So, we are fortunate in this situation that we are given the name of the medication. We're not needing to investigate that or come up with that. They tell us what the medication is. In this case, it's bethanechol. But that requires a little bit of information about what bethanechol is. So if we take a look at the next slide, you can see that bethanechol is a cholinomimetic agent. So it's a cholinergic agonist that mimics the actions and effects of acetylcholine at muscarinic receptors. Okay. So you can see there, if you were to have muscarinic effects, that would potentially include diarrhea, urination, meiosis, bronchospasm, bradycardia, and as Sean was underlining bronchospasm. That's one of the adverse effects of too much muscarinic activity. In this case, that's the downstream effects of having a cholinomimetic activity. As you can see there, it's also important to know what kind of activity. In this case, we know it acts on muscarinic receptors, not nicotinic receptors. Okay? So that's why answer choice B, or dyspnea, is the best answer. If we take a look at the question again, and we take a look at those other answer choices, sensitivity to light would be something you see with pupillary dilation or mydriasis. This is the opposite of what you would see with bethanechol, which causes meiosis or pupillary constriction. Okay. Involuntary muscle contractions, that could be possible if there was a lot of activity at nicotinic acetylcholine receptors. But as we said, bethanechol works at muscarinic acetylcholine receptors. Hypertension as well. As we know, bethanechol is actually a cholinomimetic agent, so unlikely to cause vasoconstriction and increase your blood pressure. And lastly, decreased urinary output. This is actually an agent that can be used to treat urinary retention or decreased urinary output, because cholinergic activity would actually would increase urinary output. And that's because you're inhibiting the muscarinic receptors. You are getting rid of the inhibition of muscarinic receptors. So you are allowing for increased urinary output. So the best answer choice here is answer choice B, but this all kind of stems back to that acetylcholine pathway and its downstream effects.
Well, thank you very much, Paris. Great explanation as always. Definitely a challenging question. Let's move on now to our second question of the evening. Once again, the answer choices are covered up. That is by design. We'll begin with the lead. Which of the following medications was most likely prescribed? Which of the following medications was most likely prescribed? Give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And we'll move on to that vignette. Speaking of that question box, if you have any questions for our coaches, please let them know in the question box and they'll do their very best to try to answer those questions for you. All right, so the response is coming in. Let's take a look at that vignette. A 42-year-old woman comes to the clinic for a follow-up examination. She was prescribed a medication 1 month ago to treat insomnia and nervousness due to worry over her financial situation. Though she was initially prescribed a 2-month supply of medication, she has already run out. She reports that she now needs twice her original dose to achieve the same effect and does not feel well when she does not take the medication. She continues to sleep irregularly. The patient appears more anxious. She is sweating profusely and tapping her feet restlessly. Which of the following medications was most likely prescribed? Paris.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and lead-in. And so now you can see we have a little bit of a longer vignette. Okay, now we have a 42-year-old woman, and she's here just for a follow-up. Okay, well, we know this is a pharmacology question because, as Sean read in that lead-in, it was asking us about the medication most likely prescribed. So we want to get as much information from this vignette that can help us figure out the medication. Okay, so we are told what it was prescribed for. What are the clinical indications it was used for? Okay. We're also told about how the patient is feeling, some dosing history that the patient has with this medication, and how she's doing now after taking this for a month. Okay, so some important clues there that are going to help us get to our correct answer. As you can tell, this is probably a 1 or 2 step question. I think one, we need to figure out maybe what medication is prescribed just based off the clinical vignette. So I think it's probably in the realm of like a 1-step question. But you know, we are going to have to take a look at those lists of answers they provide us and see is there anything that you know, we need to do a little bit further differentiating as well. Okay. So let's take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. E, thiopental. D, oxazepam, C, hydroxyzine, B, diazepam, and E, buspirone. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer. We'll talk about it in just a few seconds.
Excellent. Well, thank you, Paris. Once again, the poll is open. We'll wait until about 2/3 of you have responded. As you see this evening, we're going through the incorrect and correct explanations. Make sure you do that when you do questions. Make sure you're not just looking at the correct answer and moving on. You want to make sure you got it right for the right reasons. You can learn from the incorrect explanations as well. All right, a few more seconds here. Let's go ahead and take a look and see what all of you selected. 49% of you selected diazepam, and in distant second place was oxazepam with 26%. So let's take a look and see what the correct answer is. And the correct answer is D, oxazepam, and 26% of you got it right. So another challenging question, but don't worry, let me hand it off to Paris and he'll give us the explanations. Paris.
Thank you, Sean. Yes, definitely another tough question here. So let's take a look at this question. You know, this patient, as you can tell, was given a medication to treat insomnia and nervousness, okay? But now she's having issues sleeping. She's even more anxious, okay? And this is what we call dependence, physiologic dependence, okay? Where you almost become dependent on a medication and need more and more of it. And that's essentially what's happening. And this is something that we see with benzodiazepines, okay? So hopefully you guys were picking up on that. This was benzodiazepine that was prescribed, okay? Now, they can be good for treating anxiety, but you have to be careful about that potential for dependence and tolerance as well, okay? So we need to use them with caution. So let's take a look at the next slide. And this is a nice table in first aid talking about benzodiazepines, okay? Now, if you look at those adverse effects, you can see there that this can cause dependence, okay? This can cause dependence. On top of that, with the mechanism, under that row of mechanism, you can see there that some of them are short-acting. Alprazolam, triazolam, oxazepam, and midazolam. These are short-acting, so they have a higher addictive potential, okay? They also have a shorter half-life, so they don't last as long. So that's why patients take them more, and the effects of the medication run out quicker, okay? So that's why when we go back to our question, we look at the answer choices, there kind of was a second step there. We needed to figure out the difference between oxazepam and diazepam and know that oxazepam is shorter acting than diazepam. So higher addictive potential, more chance for developing dependence to that medication. Now the other medications, thiopental, that is a barbiturate that can cause cardiovascular and respiratory depression. That's used more so for anesthesia, so not an outpatient medication usually. Hydroxyzine is used for itching, and it's not the best answer choice here. We'll come back to diazepam. Answer choice A, buspirone. This is also an anxiolytic agent, but this has a slower onset of action. It takes a couple weeks to show any effect, so probably not something that would have the same short half-life leading to dependency. Lastly, diazepam. This is a benzo with a longer half-life, okay? So it's long half-life, it reduces, you have less of those withdrawal symptoms as you are slowly, spacing yourself out of that medication. So probably not the best answer here. So the best answer choice here is D, knowing a little bit in depth about the pharmacodynamics of benzodiazepines.
Thank you very much, Boris. Great explanation as always. I know I mentioned RX Coach earlier, and I want to take a minute here just to tell you a little bit more about it. So RX Coach is our one-on-one coaching and tutoring program. So if you're studying for a comprehensive exam, a board exam, then what we'll do is we'll start you off with one of our 160 question assessments. Now, we look at that assessment not for the score, but to look at your subject area and percentage breakdown. Remember, we've been in medical education for 30 years. We're the only tutoring company or coaching company that's actually been in medical education prior to starting tutoring. We've authored resources like bricks, express videos, flashbacks, question max, or question bank, as well as, of course, our founders authored first aid for the USMLE. So we have a lot of data that we can use to help create a more efficient study plan for you. If you're in medical school studying for exams, then what we'll do is we'll use your syllabus, the resources you have, as well as the ones that we'll provide you to make a personalized study plan for you. And we'll work with you one-on-one to implement that study plan, identify and bridge your knowledge gaps, as well as work on your test taking skills. You know, a lot of students, they're willing to put in the effort and the time, but they don't see the results match their efforts. And that's simply because they're not USMLE or med school experts, right? We are. So we can take that guesswork out. We can make your studying more efficient. We can help you master your test taking skills and help you maximize your potential on test day. All of our tutors are highly trained and they're certified, and we will give you access to RX 360 Plus, which includes all of our resources. So if you're interested in working with the coach to really ensure that you're doing everything you can to set yourself up for success, reach out to us at rx-coach or rx-coach.com. You can set up a consultation. It's completely free to talk about the tutoring program and see if it's a good fit for you. So if you want to discuss the program further, that free consultation is available at rx-coach.com. Once again, today is our 100th question lab, and as a result of that, instead of having one raffle winner, we're going to have 5 winners this evening. So make sure you stick around until the end because you might be one of our lucky winners. And with that, let's get into our third question of the evening. Once again, the answer choices have been removed, and we will begin with the lead-in. Administration of which of the following medications is the best next step in treatment? I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. Then we'll move on to that vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 69-year-old man is admitted to the hospital for management of a pulmonary embolus for which he receives heparin. 5 days later, he reports bilateral leg swelling and pain. Ultrasonography reveals bilateral occlusive thrombi in the popliteal veins. Platelet count is 27,000. Prothrombin time is 12 seconds, and activated partial thromboplastin time is 65 seconds. His heparin is discontinued. Administration of which of the following medications is the next best step in treatment? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay, so now we've got a 69-year-old male, and we were told why he's here, managing a pulmonary embolus, a very severe condition. Again, we know that they're asking us about a next step question, so a treatment type question involving a medication. So we definitely want to make note of anything medication related, anything we're going to need to use to figure out what we want to do next. Okay. So they give us some important information. They told us that he is receiving heparin. 5 days later, he has this leg swelling. They give us some laboratory values. They tell us the heparin is stopped. Okay, so it seems like they're asking us which medication do we want to administer as that would be the best next step. Okay, so I think we've got a couple things going on. I think one, we've got to figure out what's going on in this vignette, what's going on with this patient, and then two, based on that, what do we then want to do medication-wise? So I think we've got a nice two-step question here. So let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom and work our way up to the top. Answer choice E, warfarin. D, vitamin K. C, protamine sulfate. B, direct thrombin inhibitor. And A, aspirin. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Well, thank you very much, Boris. The poll is open. As always, we'll wait until about 2/3 of you have responded before we move on to our last question of the evening, and then, of course, our raffle. For those of you who are wondering, next week's topic is reproductive, and we hope to see you here. All right, I see responses coming in. We'll give all of you a few more seconds here. Let's take a look and see what you selected. It was close. 39% of you selected protamine sulfate and 32% of you selected direct thrombin inhibitor. Let's take a look and see what the correct answer is. And the correct answer is B, direct thrombin inhibitor. And with that, I'll hand.
Thank you, Sean. Yeah, so definitely another tough question, but a very important question, and one that's very important clinically. So, what's going on? I think we need to figure out that first step. What's this patient's issue here? So he was started on heparin for a pulmonary embolism. And then a few days later, now has swelling and pain in the legs, found to have occlusive thrombi, or DVTs in the popliteal veins. Okay, so why did he develop blood clots after starting heparin? Well, if you remember, heparin can actually cause thrombosis. It's called HIT, heparin-induced thrombosis, or thrombocytopenia. Sorry, heparin-induced thrombocytopenia, where patients are at risk for thrombosis. Okay, if we take a look at the next slide, this is our nice table from first aid talking about heparin. You can see there the information about HIT, heparin-induced thrombocytopenia. Okay, and this is where you get lowering of blood platelet counts starting shortly after heparin, but then also you're at risk of thrombosis. Okay, and you can see that in HIT type 2. Now you can see there the treatment is to discontinue heparin. You want to discontinue the drug that's causing the patient to get blood clots. That makes sense. But they also need another anticoagulant, right? One, because now they're in a thrombotic state. But then two, they also have a pulmonary embolism in this case. So this patient needs anticoagulation, especially to treat this thrombotic condition. And the most commonly used anticoagulants are direct thrombin inhibitors like argatroban. Okay, so if we take a look at the next slide, this is our first aid table on direct thrombin inhibitors, DTIs, or argatroban, bivalirudin, dabigatran. These are direct thrombin inhibitors, and you can see there they can be used in HIT, heparin-induced thrombocytopenia, where heparin is bad for the patient. Okay, so in a setting where a patient develops blood clots after starting a few days after starting heparin, you want to be on the lookout for HIT, and you may need to stop the heparin, and you may need to switch them to a different anticoagulation, one of which would be direct thrombin inhibitors. So if we take a look at the other answer choices, warfarin. Warfarin is good for preventing thrombus formation, but remember it takes a few days to take effect, and it's actually more procoagulant initially. Okay. Answer choice D, vitamin K. This is used to reverse the effects of warfarin, so not really relevant in this situation. Protamine is if we were dealing with a heparin overdose, okay? But again, that would be more so too much heparin, so more bleeding type issues, not clotting issues. And lastly, aspirin. Aspirin is probably too little of a drug to really help with the thrombus formation. The best answer choice here would be B.
Well, thank you very much, Boris, for another great explanation. Let's move on now to our last question of the evening on the topic of pharmacology. Once again, the answer choices have been removed, and we will begin with the lead-in. The new medication that increased the risk for this patient's gastric findings has which of the following mechanisms of action? I'll give all of you a few moments here to respond in the question lab and let us know how many steps you believe this question will require. And then we'll move on to that vignette. All right, let's move on to that vignette. A 60-year-old man comes to his primary care physician because of abdominal pain and dark stools for the past 3 days. He has a history of gout and osteoarthritis that is managed with allopurinol and ibuprofen as needed. 2 weeks ago, he was given a different medication to use for a short period to control a flare of gout. Abdominal examination reveals mild epigastric tenderness. Stool is heme positive. Upper gastrointestinal endoscopy reveals hyperemia of the gastric mucosa and the presence of numerous linear ulcerations with evidence of bleeding. The new medication that increased the risk for this patient's gastric findings has which of the following mechanisms of action? Boris.
Thank you, Sean. So, now we're going to go ahead and show you again what we think are the important clues here. And, this is our 4th time doing this. We've kind of walked you guys through what we think, are those important clues in those vignettes and the lead-in so that you can come to the correct answer, okay? And so hopefully you guys are starting to pick up on that and getting a good sense of what are those subtle words and phrases that we need to be taking note of, okay? So now we've got a 60-year-old male who's coming in because of 2 issues, abdominal pain and dark stools, okay? And we know a little bit about time frame. We know this has been going on for 3 days, okay? We see there that this is a nice clinical question, so there is some information about past medical history, medications he's on, a different medication he was given, okay? And then the question is asking us about a new medication, and that new medication he was given that increased the risk for those gastric findings, and what is its mechanism of action. So I think we've got a 3-step question here. I think 1, we've got to figure out maybe what's going on in this patient. 2, what was the medication that increased the risk for that or contributed to that? And then 3, what is the mechanism of action of that medication? So nice 3-step question here. So let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, inhibition of xanthine oxidase. D, inhibition of the sodium-potassium ATPase pump. C, inhibition of the proton-potassium ATPase pump. B, inhibition of beta-tubulin polymerization into microtubules. And A, binding and activation of intracellular receptors. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Paris. This is our last question of the evening before we move on to our raffle. Let's try to finish strong. We'll give all of you a few more moments here. Next week's topic is reproductive. Hope to see you then. All right, let's take a look and see what you selected. It looks pretty close. 34% of you selected inhibition of beta-tubulin polymerization into microtubules, and 30% of you selected inhibition of the hydrogen potassium ATPase pump. Let's take a look and see what the correct answer is. And the correct answer is A, binding and activation of intracellular receptors. Definitely our most challenging question of the evening. Let me hand it off to Paris.
Thank you, Sean. Yes, definitely a tough question here. So what's going on in this patient? What's that first step? Well, hopefully you picked up on, this patient's having a GI bleed, okay? Evidence of bleeding from the gastric mucosa, okay? So GI bleed or gastritis, okay? Inflammation, irritation of that gastric wall. There are often things that can cause gastritis, and we know that NSAIDs like ibuprofen are associated with that, okay? And the effect of that is worsened with glucocorticoids, okay, like prednisone. Now, sometimes we give prednisone for control of gout flares, for other acute issues as well, okay? So this patient was most likely given a corticosteroid like prednisone, okay? And that can increase your risk for peptic ulcer disease and gastritis as well, okay? When you take steroids along with NSAIDs, that actually doubles your risk of GI side effects from the NSAIDs, okay? Now, how do steroids work? As you can see here, this is a nice pathway in first aid talking about how steroids work. You can see that they activate intracellular receptors, okay? So these are intracellular receptor acting hormones, okay? Now, if we go back to the other answer choices, I'm sure some of you might be wondering why those are incorrect. So answer choice E, inhibition of xanthine oxidase, that's actually talking about allopurinol. One, it's not used to treat acute flares, and 2, we already know that he was taking it, so it's not a new medication. Answer choice D, this would be talking about something like digoxin, so not as relevant here. Answer choice C, this would be talking about proton pump inhibitors, okay? And these are actually used to treat reflux and peptic ulcer disease, so that kind of is the opposite here. I think a lot of you guys selected answer choice B, inhibition of beta-tubulin polymerization. Now that's talking about colchicine, as you guys may have figured out. Colchicine. Colchicine can be used to treat flares of gout, okay? So in and of itself, that might be a correct answer to think about. But colchicine doesn't really increase your risk of gastric bleeds, okay? It has other side effects like diarrhea, cytopenias, liver failure, neuropathy, but not gastritis or peptic ulcer disease, okay? So that's why you kind of have to go a different route and realize that colchicine may not be the medication that was added because that wouldn't increase this patient's risk of gastritis. So definitely a tough question, requires a few steps and different pieces of knowledge to piece that together. But definitely a great job today on some of these tough pharmacology questions. Hopefully that was good practice for you guys. And I'll hand it over to you, Sean.
Thank you very much, Boris, and thank you all for being here during our 100th question lab. So if you want to review these questions in more detail, you can simply make note of these question IDs and enter them into the RX search field and review them further. So I'll leave this up for a couple of seconds and let you make note of these numbers. All right.